We have a growing and aging population, more people needing care for longer, with fewer people paying for it. This is not sustainable. It is also not helped by the disconnect between and within primary, secondary, and social care, which often leads to human errors. We see this disconnect everywhere. Here are some examples from challenges faced by tendering care line.
Our service users will be interacting with more than just one agency, so they might be seeing Careline for one aspect of their care, but then they might be communicating with doctors, surgeries, community agents, and then voluntary sector. And the biggest issue for us is how do we brief the wider community that's also involved with that service user exactly what has gone on.
So, for instance, you might have a service user who's got a social worker involved who are concerned that person can't stay at home and live independently, and they might be working to get them extra care or to move them somewhere else. And that's not always easy for a social worker to prove that person needs that extra support. So if they were aware that actually that person's pressed their pendant and called for help 5 or 10 times every day, we are going out to that service user 4 to 5 times a day. The social worker would be unaware of that information because we don't share the data with them.
The scale of the problem is highlighted by a government-commissioned report which shows that there are 22,000 deaths and 230 drug prescription-related errors annually. It is little wonder that the Health and Social Care Secretary said that poor NHS tech is downright dangerous. In a nutshell, by removing the disconnect, simply ensuring that those delivering care can be confident that the data they are using is the most up-to-date will significantly cut human error, thus saving lives, improve quality of care, and releasing care capacity that would otherwise have been spent on corrective actions. However, this requires a radical change to move where patient records are managed in one place rather than being scattered across multiple disjointed systems in primary, secondary, and social care, as it is the case today.
So it's really important for us to know as much information about a service user as we can. Now, we might be in a position where the doctor has recently put a service user who's got quite severe dementia onto medications such as blood thinners. If we're unaware of that, a carer could be going in and giving the service user their medication, and we get called because the service user has fallen. Now, if a service user falls and they are on blood thinners, that is an increased risk of an internal bleed. So it's really important that we know that information. We can pass that information on to the ambulance service if necessary, but just having all of that information in one place would help everybody because everybody would know exactly what's going on with that service user and mitigate any risks.
Absolutely not. History tells us that centralized databases never work because they are cumbersome, inflexible, and take decades to implement. Instead, patient records can be managed locally for a GP practice or a hospital catchment area or on a local authority level. The good news is that NHS and social care organizational structures are moving in this direction. This is the right way to go because it provides local autonomy while still working within a national framework. This, in fact, was one of the key recommendations of the Watchdog review into the failure of the 14.2 billion National Program for IT. Patient records are managed as complete, consistent, and up-to-date sets, and independently of how they are used today or in the future. This is very important because how care is delivered and with what technology aids it is delivered are in constant evolution. This means we cannot predict what innovative technologies will be available in the future, but we need to create the environment to harness their benefits when they become available. This is not possible in the current environment, but it is possible if we take the radical step to manage patient records in one place